my name's Lois, and I'm a senior here at Columbia University. This is the first in what I hope will be a series of interviews where I get to introduce you to some amazing people who work and live within this hospital. So I'm honored to be kicking things off today with Dr. Faisal Shaikh. Dr. Shaikh is an interventional pulmonologist here at New York Presbyterian Columbia Irving Medical Center. He's also the director of the interventional pulmonology program, so he spearheads the whole thing. And I've been having the incredible fortune of shadowing him this summer. So, hi, Dr. Shaikh. Thank you for being here today and for agreeing to do this. Would you mind giving a bit of an introduction as to what you are?
Yeah, of course. Definitely feels like I work and live in this hospital, although I pretend to have a home somewhere outside of this hospital. Yes, so I am an interventional pulmonologist. We do minimally invasive procedures, usually for the chest, whether in the lungs or around the lungs. A lot of it's lung cancer, so a lot of what we deal with is lung cancer and sort of that adjacent culture around taking care of a patient with either a new diagnosis or a late-stage diagnosis of cancer. So a lot of this is a little bit new to me. I mean, I went into the field because it was fun. It was a lot of tech, a lot of procedures. We do a lot of robotics works, but it's sort of a surprise to me in a way that I was going to end up dealing with sort of lung cancer. I trained a lot of different places in the States. So down south in Tennessee for medical school, came to New York for residency, went to LA for fellowship, went to Boston for fellowship, and then I got my first job here at Columbia, like Lois mentioned, to spearhead the program, which didn't exist at Columbia, and it was a bit of an adventure introducing, a new thing to an old person at Columbia.
So LA, Boston, New York, where did you grow up then?
I grew up in Saudi Arabia for the first my childhood, then in Pakistan, my family's from, and then the rest of the growing up was in the South, Tennessee, Virginia.
Was anyone in your family in medicine?
Yes, Dad is a cardiologist who never talked about his work, never really wanted me to go to medical school. I was always interested in other things, but as part of the immigrant culture, you're either like a doctor or a lawyer. So this is how I ended up where I am.
Do you think your dad kind of influenced you in some way pursue medicine?
I don't know. I mean, like I said, he didn't really mention it to me.
Okay.
We didn't really talk about it as much. Obviously, it was obvious in my life that he was like under home scrubs and the dude was a doctor.
Mm-hmm.
Yeah, I mean, certainly the way he carried himself and like, I guess part of the lifestyle we lived and enjoyed as children was relative to his career. So that must have had some sort of influence, whether it was subliminal or overt. I would say more on the subliminal side, I guess.
Right. Okay. Now, before we continue, I don't know if this is a bit of a secret, but like 2 weeks ago, you gave me candy.
Yeah.
Yeah. So like, is it like a secret that hospital staff like hide candy in the drawers? Is that a thing?
No, for sure. It was something that was supposed to be totally off camera.
Really?
Yeah, and I found a little secret stash, although soon afterwards the stash was gone. So I think everybody found out about the secret.
How? Okay, well, I got us candy for this interview.
Oh, no
it's
way.
from this like Swedish candy store called Bonbon.
Sure. Dude, we're definitely going to pop this in the OI for sure.
Okay, yeah, perfect.
Just have to hide it from like the police that exist there. This is great.
So, since you said that obviously you had some family, or not family influence, but you had some family exposure, did you have second thoughts about being in medicine?
Yes, for sure. I mean, I was a history major. I was like looking to do something very different in college. Although I was sort of setting myself up for it. I wasn't necessarily totally anticipating this. There's definitely other ideas that crossed my mind. In the end, I do like where I ended up. I think for me, it ends up being a good mix of doing clinical work. Since I had to start the program, you were doing a lot of administrative work, getting involved in like the business side of things. You've seen those frustrations. In a way, it feels kind of unique and lucky to do a completely new thing within your career. So that was There's nice, but yes, definitely other thoughts.
Definitely other thoughts. And like, how did you kind of overcome that uncertainty? Because medicine is just
Brutal.
it's brutal, and I feel like once you decide on like going through the medical path, you have to literally kind of stick through that.
Yeah, I mean, I think it's. I think we may have had this conversation before, but you know, in a way, there's such a myriad possibilities and different things you can do with medicine that it feels sort of genuinely broad at the same time as you sort of made this irreversible decision to go into medicine. It sort of opens up, you know, still a lot of possibilities, which is kind of, I guess, sort of an oxymoron or a conundrum. So, yeah, in terms of how I made that decision, I think ultimately I felt most fascinated by the mechanics of the body. When I was in college, I took a class on physiology, and I think like just learning how this sort of microcosm of the body worked, I was like totally fascinated by this, and I told it.
I mean, as a doctor, and I've also seen this, but you have such an incredible life, but also some of the cases that I've been able to scribe in on and see, it feels so challenging at times. And I was wondering, what would you say is like the most difficult thing faced as a doctor? Could you share maybe like one example that was either like surgically or emotionally difficult for you?
Yeah, I mean, I think everyone. I mean, I think all these moments hit us differently, and at different times in your career, you have moments that you find difficult for different reasons. I think for me, probably the most challenging thing that I'm facing in my sort of era as an attending is obviously you take full responsibility for whatever happens to your patients. And previously, when I was working, mostly it was hospital-based, and I was dealing with very, very sick people, and they would die. Not just on my account, but when you're an attending, in this case, especially doing these surgical procedures, which we call ambulatory, meaning the patient goes home or should go home with a 99% chance of, you know, without complications. And you have a complication, and sometimes you're catastrophic and unanticipated. And so, you know, in comparison to when I was working more exclusively in the hospital, the patients would come sick, maybe not verbal, maybe already with a breathing tube, and you don't really have that sort of connection to what they were like when they were walking around in the real world. Whereas now, you know, before I do the surgery, I bring the patient into the preoperative area and they walk in. And so, you know, recently, I think even you were there, we had a patient who was walking and talking, living her life normally, and came in for one of my procedures and ended up, you know, with a big, you know, catastrophic complication. And it's very difficult to take ownership and responsibility, or to realize that it was your responsibility that this patient came in walking and electively signed consent, and then, you know, it's not in that condition after the procedure. So that's been, I think, the most challenging thing for me.
And then following up with that, you're in a place where people die every day. Has it kind of changed your relationship with life or and death? Do you view life and death differently now?
Well, you know, when, like, before medical school and during medical school, you're not thinking about death. You're thinking about, like, you're in whatever square. You know, without, I don't even know.
Step score.
There you go. So, you know, we always have time to self-reflect. Sure. You know, I think it's a very interesting question that is not asked commonly. So even like myself, like, but I think, you know, yeah, you're right. I mean, in so many ways, you see this play out. You know, just recently, I was helping a patient, you know, and their family just yesterday, sort of, you know, sort of traipse around this question of when is my father going to die? How is he going to die? He tend to be comfortable. So I think for me, in my personal experience, thankfully, you know, I haven't had, recently at least, I haven't had, you know, a parental figure or a figure in my family pass away, but
Mhm.
I think a lot about how I would want to conduct myself in that situation and how I would want to make sure that, whenever these sort of kind of pre-death activities, like making sure you have taken care of your orders and your family, and you've made the gestures of love and gratefulness and happiness to whoever you want to make those to before you pass away. I think oftentimes patients come in and pass away without ever having had that kind of closure. So I think it makes you think about your relationships with the people that are close to you and sort of puts things into a perspective which is a little bit more, I don't know, realistic, and also at the same time, living more in that moment to be able to sort of express those things that you wouldn't otherwise be forced to.
Following up from that, do you also view bodies differently now compared to vet school?
Yeah, I mean, for sure. I mean, especially when you're in the throes of the books and studying anatomy and stuff like this. I remember one time I was sorry for the grotesque reference, but I was like peeing in the bathroom after studying nephrology, and I was like, now I know who I'm out to this whole time.
Do you view bodies?
Yeah. Yeah, I do. I think it's, it's just, I think even in so many different parts of your life, you view and interact with bodies differently. Like, in romance, even in like a caress, even in like just sort of looking at your, looking at different organ functions that your body has that like everybody doesn't think about, like breathing. I mean, like what part of the reason why I went to pulmonary is, what can be more romantic than knowing and understanding a breath? It's a beautiful, beautiful concept to me. It's maybe a weird way to sort of, look at a breath, which is a subconscious thing, and know exactly what's happening, down to, idiosyncrasies of medicine.
Mm-hmm.
Which some people may say like takes away the romance of it. For me, it made it all the more vital. So yeah, I think it's a nice, it's a completely privileged interaction with the world when you've gone through this kind of study.
Thank you for that. And this is a little bit off of a tangent, but back when we were talking about the business side of medicine, I didn't have to admit to that, but I was wondering, how does it change you most like to see in a hospital?
It's interesting. I think Columbia gives me a very different perspective. The most obvious change I would like to see is that the community of care, especially from the physicians, should reflect more the community being cared for.
Yeah.
And whether that means the access to care needs to be fixed, or also the people who are bringing up in medicine needs to be changed to address this interaction. Because I think when in the moment where I can fool a patient that I actually speak Spanish, they feel so much more comfortable, with me. I don't actually speak Spanish, but maybe for a minute I have like a decent accent and I know a couple of words, and they get so excited just to sort of feel that cultural connection. I think that's super important in healing. And having a healing relationship, with your patients, and the same for you. I think as a physician, not to feel yourself distanced from your work, which can become the dogma. Having that cultural connection with your patients is, I think, really, really brings yourself into more sense of taking care of your own community or community around you.
And then obviously when you're working in a place that can feel mostly very powerful, but also powerless, how does it feel to kind of live with that tension?
Yeah, it's a good question. It's a good question. Definitely, I think when you take a step back, you feel that powerlessness, but in a way, I guess it's just sort of an allegory for the rest of the world outside of the hospital as well. My favorite quote from like this physicist was like, something we know not is true and we don't know what. That is what our knowledge amounts to.
Living on.
And I think like that encapsulates this sense of powerlessness. And I think, regaining a sense of power is important for anybody's like in and the ego from the concept from like this sort of psychological concept, not like an egotistical concept. And I think having, giving a sense of power to people who otherwise aren't allowed to have that. For instance, like people who are on my team, like my co-attendings, my nurse practitioners, and sort of relinquishing a sense of power to them in ways is really, really helpful to me to maintain, a sense of engagement to my work and myself, as well as everybody who's around me. So the team that I'm surrounding myself with is, is engaged, is interested, is happy. It's important to remember that you're both powerless and powerful at the same time.
Regarding your team in high pressure OR cases and settings, who else would you like to see receive the credit that they deserve?
Yeah, at the end of the day, I always try to thank my team if things go well or if things go poorly. And certainly during the case, I always try to make a point. I don't know if I always have done that, but I always try to make a point of remembering who was there and who being helped. And I often find myself at the end of the day sort of texting the people that were on the team and saying thank you, whether that's a technician, a nurse, and or the other doctors like the anesthesiologist or another search I listen to with them.
So I feel like medicine often very much demands perfection, but I feel like that perfection can sometimes strip away the space to be human. What do you wish people could see or remember about the person behind the doctor?
I think, kind of like you said, it sort of demands this perfection, which is a bit of a facade. I think it's really much more of a style, and I think what I wish what people would see, and what I wish for younger physicians, younger physicians to sort of understand is that there is this sort of there's this impression of a doctor, and then there's this sort of style. Everybody needs to develop their own style, and this is what brings sort of the art and creativity that I feel like oftentimes is lost. That people don't understand that you have the license to be creative, you have the license to be stylistic, to be to sort of express yourself and through your care, whether that is manifesting in how you interact with a patient or the medical decisions you're actually making, and sometimes even how you decide to administer a medication in conjunction with others, et cetera, et cetera. Some people are hasty, some people are patient. But I think it can go deeper than that. And I think that's the thing that I would like for people to remember or see a doctor is understand and appreciate somebody for their style.
It's amazing. Well, thank you so much for being here and for agreeing to be the first person to get interviewed. It means so much to me and to anyone who hopefully watches this again. I hope you feel seen today because I saw you and I'm truly grateful for you to have let me in today.
Of course. Cool.
Thank you.